frequently, people will come in and ask for a BBL or an IPL. And we essentially have 3 different versions of that type of treatment. And so I wanted to go through why I pick one versus the other and what I do for different people. So this is the Luminous M22. This is a true IPL machine. So we're going to talk about what that actually means. This is a Palomar Icon, and this machine is called OPL, as in octopus OPL. And this is an Optimus machine, and it's by InMode. This is also OPL. So sometimes people come and ask about BBL or IPL. They don't commonly ask about OPL, but we are going to talk about what the differences are. This Luminous is a true IPL. We have different heads and different tips that we can use on here. So we have 3 different size heads. So we can have a larger tip. We can have a medium-sized tip for medium-sized areas, and then we can have a tiny little tip for those little tiny brown spots on like the corner of your eyes or whatever. We use IPL to treat red, brown, and sun-damaged spots. Ultimately, that is the answer, right? We use the different sizes for different parts of the face a lot of the times, but also I will sometimes do an entire face with the larger tip, and then I will go back with the smaller tip and hit the little tiny corners of the eyes where sometimes we get those little brown spots right around our eyes or right here in the corner. This particular laser also has something called a vascular tip, right? And so I can put the vascular tip in there. It filters out all the brown pigment targeting stuff and gives me just what targets blood vessels. So this is a true IPL because it filters everything down based on what filter I put in there to target specific things in the skin. It's lovely because I can use it for darker skin types and lighter skin types. I can use it for just blood vessels. I can use it for just brown spots. Most people have everything, so we treat it different ways, different parts of the face, different size tips, and different filters. In one person, I will use usually 2 different size tips and at least 3 different filters. When I'm deciding which tip or which treatment filter to start with, the way I make that decision is most of the time what's most important to the patient. And sometimes a patient will come in and they have a lot of brown, but all they see is the blood vessels around their nose, and that's really what bothers them. So in that case, I'll usually start with the red blood vessels around the nose with that vascular filter, and then I'll treat around the nose with that first, and then I will switch and I'll put in, if they're Caucasian, we'll put in the 515, and I will usually even switch out from the larger tip to the little tiny tip, and I can get all the different brown spots on their body individually with this tiny little tip if I need to, okay? And then if they have that diffuse pigmentation on the cheek, I would switch from the 515 to the 560 probably, put the larger tip back in and treat that diffuse pigment there. IPL is usually done as a package. When I talk to people about their results with IPL, I tell them I'm usually going to make things about 50% better with each treatment. So sometimes their blood vessels will get 50% better. Sometimes the brown spots will get 50% lighter, or one goes away and one sticks around. And so we usually have people do a package of treatments. The good thing with that is with the package, you get those extra results because this also does stimulate a little bit of collagen, but you have, your expectations are in line with what's possible, and it makes it a lower downtime procedure. The reason I would choose OPL instead of IPL in a patient is if they were very fair-skinned, had very light brown spots, and darker blood vessels. So this is great for Caucasian skin, not as great for olive skin, but that's why we have multiple options here. But for light skin, light spots, this energy is specifically formulated for that type of patient.